MelaMed community, we are back again. Now look, we're going to start right off with like and subscribe.
Yes, please do.
We enjoy having you guys here and hope you're enjoying the content. I am Dr. Sharon Dixon, and I'm here with Dr. Norma Mobley.
Hi, everyone.
Listen, today is an important conversation about what's happening with women in their maternal life. We are seeing still way too many women losing their life as a part of this bringing life in.
Right.
What can we say about that?
Well, one thing I can say is everyone's not having that experience. So let's just be real. There are some of us in our society that once they find out they have a new life growing, they don't have any issues with accessing that care. We have a lot of maternity deserts within our country right now. We have rural areas that have no OBGYN available at all, and they have to travel over an hour just to get that care. So when that happens, there's no prenatal care.
Right.
And so then we don't really know what's going on with that mom or that baby until sometimes it's very, very late.
With some changes that have come out of a most recent bill, we will see some more rural health hospitals close.
Right.
And we'll see more deserts, which will result, unfortunately, in more compromise for our women.
Right. So let's talk about who is having a more negative experience during pregnancy and healthcare here in the United States.
Well, unfortunately, it is Black women.
It's us. Yeah.
It's always Black women. Now, we are some of the strongest creatures on the earth. We do a whole lot of things, but it sure does seem like a lot of stuff tries to impact us.
It definitely does. And it's not anything that's brand new.
No, it's not. And, you know, a birth of a child is supposed to be one of the most important things, and it is. It's one of the greatest things that we do, is bringing life into the world. But there's so many stressors for Black women.
There's lots more stressors, and then also we are not heard. When a lot of times when we interact with the healthcare system, we're not heard as far as our physical complaints. And I know I can think of a young lady who ended up delivering her second child at home because after presenting to the emergency room twice, stating that she was in labor, she was turned away.
Oh my goodness. Yeah, we hear those stories quite a bit. And that brings us back to our advocating for yourself.
Right.
You know, women, you just have to say, I'm not going. Something is not right.
Something is not right. It brings us back to the advocacy part and also to the representation part.
Yes.
Because we do know, statistics tells us that people who practice medicine in communities where the patient population identifies with them, that healthcare delivery is more personalized.
Right. And you have to think about what are the typical things that affect that population, right? So many Black women experience preterm labor, or they experience what we call preeclampsia, hypertension, and other things that cause a premature labor.
Correct.
And so we have to have those things in our mind when women come in with complaints of something's not right.
Right. And you know, a lot of times people think that we're being hyper-focused on this issue. However, I don't believe it's being hyper-focused. It has no bearing on your educational level, your socioeconomic status. I mean, everyone has read about the experience Serena Williams had.
Right.
She had to advocate for herself, but that could have had a totally different outcome.
It sure could. So it doesn't matter what your status is. I just recently heard Cardi B singing one of her songs that she had preeclampsia.
Wow.
So, you know, it can happen to anybody, from those who live in the hood to those who are creating the hood. So, you know, it's a commonality that Black women have, no matter what their socioeconomic status is.
And when that happens, what does that mean about our children, the babies that are being born?
That's right, and that's where we see them, right?
Right.
So if we get a preterm baby, then we're talking about greater healthcare issues throughout their life.
Throughout their entire life.
Mm-hmm. And everyone wants, the baby they're looking for 10 fingers and 10 toes, and do they have their eyes in the right place?
Chubby cheeks.
Chubby cheeks.
Mm-hmm.
But what about, their quality of life if they are born way too early?
Correct.
Yeah.
There's a lot of healthcare costs that are incurred as well for taking care of that child afterward.
And unfortunately, we have times when the mom does not make it. And that, we talk about it being at the time of birth, but many Black women lose their lives at some point within a year of the baby being born.
And the other thing that's so important, so one of the things that we talked once before about how we as women of color in medicine have a tendency to we identify some of those needs in our patients that others may not. For example, you shared about how during residency you used to sit with that child when you were on call.
Right.
I happen to pay close attention to my mothers bringing in their newborns, looking at their hands, their feet, their ankles. I'll check their blood pressure. I'll call their obstetrician and make an appointment for them, because 6 to 8 weeks after pregnancy, they're still at risk for preeclampsia.
And not everyone is thinking about that.
Mm-hmm.
Let me check the mom. I'm the pediatrician, but let me check the mom. That's important,
Right.
especially in our population.
And part of our role is making sure, in order for the baby to do well, mommy has to be doing well.
That's right. It's all a part of growing a healthy baby.
Correct.
Even beyond the pregnancy itself.
Correct. Absolutely. And you're right. We do look at those statistics for up to a year after the birth of the baby.
So we still want to encourage you to do the right things. You want to make sure you're getting good prenatal care.
Correct.
Established with a physician who you can have that relationship with, who understands what's going on with you, who can think beyond just the mundane. Think about what may be a problem for that particular patient just because of who they are.
Right. Now, you said make sure that you get prenatal care. We just talked about there being OBGYN deserts. How can we ensure that women do have ready access, women of color specifically, having that ready access to good quality prenatal care? We have got to get that pipeline together, ladies.
Absolutely. We need the pipeline, and we need to know that there are several opportunities for us that we may not be thinking about. One I love, and folks may not think about it, is the federally qualified health centers that are available that look beyond your ability to pay. Those systems look at sliding scales, but are there to provide care for those who may need it and don't have a high source of funding.
Right.
For them. But also just knowing the OBGYNs that are in your area, looking them up, getting some ideas of who is caring for who, from your friends even, who they saw. But certainly if you are living in an area where there is a desert, there are other types of providers who can care for you until delivery. But it's important for you to explore that.
And you may have to consider a family practice physician as well,
Right.
who can also provide you with prenatal care.
And we do have mid-level practitioners who care for our women who are pregnant, and
midwives.
we have our midwifery ladies as well, or men. There may be some women.
Correct.
But those are other types of providers who are there to help your pregnancies.
To meet that need.
So just think about that. Not unfortunately, not a lot has changed in terms of our maternal outcomes, um, but they can if we are attentive to it, if we are finding providers who understand our differences and who listen to us when we say we need further help. Ladies, make sure that you are getting to a provider who cares, and providers, think about how you can make sure that especially women of color are getting everything that they need.